last release, our own very much Sonal Giani. Sonal Giani is a dynamic activist with over 15 years of experience advocating for LGBTQA rights in India and South Asia, currently serving as a board member with UNAIDS program coordinating board and as an NGO delegate for the AIDS Pacific region, and holding the position for Global Senior Advisor Gender and Inclusion at the International Planned Parenthood Federation. She offers valuable technical assistance facilitating the implementation of inclusive strategies and empowerment approaches in the field of sexual and reproductive health and rights. Thank you, Sonal, for being a part of this panel. Thank you. I'm sure a lot of people have questions, and then we will open for that as well. Coming to Sonal, actually. Sonal, I remember you were part of the sex work assessment, which was done by South Asia Regional. And why, because from the morning, I think we have a lot of community members, basically. We are so much discussing about heteronormativity of the event in many ways. And also, more inclusive is the necessity. And can you just tell us about what actually, what has come out of that, and very, very importantly, why at this juncture and why?
I think it started with the International Planned Parenthood Federation actually coming out with a policy on sex work. There were a lot of differing, conflicting, sometimes opposing opinions around sex work, but this is a community that we are clearly working with, and it's a high priority community. And the reason it has been a high priority communities, I mean, there are so many communities that are key populations, that are marginalized communities that you have to work. The reason we had to kind of tilt towards sex workers and LGBTQI is a kind of pattern that you're noticing of a rampant criminalization that is spreading across the globe against sex workers and against LGBTQI populations, which literally puts them at the risk of death in simple words as that. So, following the sex work policy, which was also very highly consultative process, because, we've been working with the sex worker community, and they were like, that's nice, you keep calling us to conferences and things, and we get to talk, but then what after that? And so, to keep the commitment, we needed to have something in the form of a policy, that as a federation, what do you believe in? What are you going to do? And so it started really with the policy, and following the policy, I think it was so important for us to understand the context of our region, South Asia region. So before you even start working with sex worker community, instead of expecting them to educate you, it's important you also, do your homework. And so that is why the South Asia region, following that, the approach of the policy, decided that let's work on doing an assessment of the South Asia region. So that's how basically it began. And how we did it was very similar to the policy process, where it was of course, all our members in those different countries, they were consulted with, but also sex worker communities were consulted with. And the external consultant actually was a community-based organization of sex work. So they are the ones who conducted the whole research, and they actually a fantastic organization called Ashodhya Samiti, which has trained sex workers to do research. So they were the body who
came community-based organization.
Community-based organization. So, but I think in terms of what are the findings that came out, to kind of keep it brief, of course, in terms of the legal situation, right? It's the criminalization. There are different levels of criminalization in different parts of the South Asia region, and essentially, more than one could say, right? In terms of the sex worker community, the majority that we speak about them in the sexual reproductive health and rights space is around HIV, as though HIV is a big problem. But actually, the study, the assessment clearly, points out that it's not HIV, it's stigma and discrimination, and it's violence. And all of this is very much connected to the political and legal situation. And so there were certain factors which were very common across regions, but there were certain which were very unique to particular countries. So the common pieces were, of course, the fact that, there isn't like full decriminalization. It is used against people. So they are very much at, risk. The body in the public space is constantly at risk of being harmed or violated with. Then there are certain laws where it looks like it's good. They have said that we are okay with with sex work, but not with prostitution. So then, they are criminalizing a pimp, but actually, essentially, what's happening is that raids happen, in the country, and then you are actually, as a sex worker, you are at